Hi, this is Teresa Nauman. I am going to discuss with you the financial views of fiscal management. I am going to use our text, the Healthcare Finance 4th edition by Baker. First, there are three different approaches to fiscal management. One is the financial view, then you have the process view, and the clinical view. The financial view is the one used by most corporate finance analysts or management. They have most of your decision making abilities. They work with the finances on a daily basis. Um, they're responsible for creating the reports that are utilized to make sure that the finances are being spent wisely. Uh, like I said, it is the corporate aspect of the finance. This is where you're going to have your CEOs, your chief executive officers, your chief financial officers. Within the hospital, the chief nursing officer is involved also, along with the board of directors. Um, let's see, strategic planning, growth, and expansion. They're all part of the responsibility that lies with the financial management and the managers. According to the text on page 5, there are four recognized elements of financial management. They are planning, controlling, organizing and directing, and decision making. And I do apologize, I've been sick for like a week, so I know I'm kind of nasally, I'm sorry. Planning. The planning aspect is to identify and create steps to accomplish the goals of the organization. Controlling is to make sure that those steps are being followed. They're going to make reports and check them against the reports prior to the steps being initiated, and they will compare them for any progress that they might find toward their goal. Organizing and directing. Organizing is using the resources that the organization has in order to effectively carry out whatever goals or plans that they have initiated. Directing is making sure the managers are out and making sure that more or less education, making sure that everyone knows what they're supposed to be doing, understanding the new processes that are needing to be followed, and using their resources to the most efficient um, process, whatever. Decision making, number 4, that is they use whatever options are available to make the choices that will help them to accomplish their goals. And decision making relies on accurate information, and those are obtained through the reports, any analysis and evaluation that are done in that process of the decision make prior to the decision making. Like I said, that's more or less your corporate aspect of the financial um, views and goals that come with an organization, as with a hospital anywhere. The second is the process view. Now, when I was researching through this is, I got to tell you, this is the unit managers, unit directors, education personnel within a hospital, infection control personnel, anybody that does research, health and safety. These are all going to be part of your process view. These are your managers that are more mid-level. They're responsible for accumulating the data um, that is necessary to make a lot of the decisions that your corporate managers are going to be making. This is where they collect your information and data. Um, this is used to create more of your evidence-based practice guidelines, and creating new policies and procedures that will benefit not only the patients and their families, but also the nurses and frontline individuals that are working on the floor. They do meet with the financial managers to maintain corporate compliance and offer necessary changes that may be beneficial to the organization, since they do see more of what's going on the floors than most of your executives. The third is the clinical view. They are responsible for the healthcare delivery. They perform direct patient care. They're responsible for the outcomes, clinical and where I work, spiritual, everything. I do work for a Catholic organization, so we are very spiritual based. There are frontline service employees. These are your nurses, your CNAs, your phlebotomists, therapists, care managers, physicians, everyone that comes in and actually sees and hands-on takes care of your patients. These are also the people that you're going to notice are more responsible for being good stewards of the resources that are offered to them. It's obvious, and I have worked in many um, hospitals and nursing facilities that did not supply decent equipment or supplies because they were not good stewards of the resources that were offered, so they weren't offering any more resources. So I have actually seen all three of these in action. The most that I see is the process and the clinical views. I see those just about every day that I work, and those are it's a huge benefit to have what you need on the floor to take care of your patients and to keep from getting injured. And those things are supplied by a corporation that cares about their employees, and it shows. The benefits and drawbacks from each of these. Sorry, my ears are just like fucking up. And the benefits to the financial process view is more or less they control the money aspect, so they're not worried about two or three different aspects of the financial um, benefit or I don't know the word I'm thinking. The process. They focus on the financial aspect of it. They focus on um, the benefit of expansion, of more employees. They look at all the information and then they bring it back and they sit down and they discuss what benefits can be offered by not complicating matters, by putting them in the middle of the clinical process, or by putting them in the middle of having to draw up that information in order to evaluate it. That keeps everybody on an even keel, and it gives everyone the second look and the feedback that they're going to need to be able to make a good decision that's going to benefit them financially. Drawbacks, probably the same thing. The drawbacks would be that they also do not see what the other people do, and they're not going to understand why a nurse would be asking for different type of equipment when they're not used to using it. So I think the benefits and the drawbacks kind of lie side by side, but when you trust your managers and you trust the individuals that you're working with and you have good stewardship of your resources, then you know that they're not going to come up and ask for unreasonable equipment or supplies. It's just good stewardship for everyone involved. And when it comes to healthcare, you really have to look at the patients and their families because that's what we're here for.